Are you a mother, father, or you are involved in caring for children? If yes, then listen to Ask the Pediatricians every Thursday by 10 a.m. for insightful discussion on popular child health topics such as dangerous child health practices, immunization, infant feeding, developmental milestones, and so much more. You also get to ask questions on these topics and listen to answers to real-life child health issues by a pediatrician. Ask the Pediatricians Foundation is devoted to health education and information of parents and caregivers of children in the community to support you in raising healthy children. Don't miss Ask the Pediatricians with Dr. Gani because it's informative, educative, and interactive. Ask the Pediatricians Hour, the program for caring parents.
Hi everyone, and welcome to ATP Hour. ATP Hour is brought to you by Ask the Pediatricians Foundation. It's a program where we provide health information, education to parents and carers of children. And we want to say thank you so much for joining us on whichever platform you're joining on today, whether you are watching me live on Facebook or YouTube, or whether you are listening on our podcast or you are listening on Fresh Waves Radio. Thank you for joining us. I am Genital and I'm a pediatrician, and I'm your anchor for today. And today we're going to be talking about something very, very important to my heart, and I guess to the heart of any pediatrician. On the 6th of February this year, it was our International Day of Zero Tolerance for Female Genital Mutilation. And so this is a day that has been set apart globally to create awareness, to advocate for us to stop female genital mutilation. So the question is, what is this female genital mutilation? And that's what I'm going to be talking about today. So I'm so glad that you joined us today. And so thank you. And please help us to share the video to your friends, to your family. You can spread it wide because everybody needs to know about the topic that we're talking about today. And if you want to watch all our past episodes, you can always watch them on the same platform, or you can go to our YouTube channel or our podcast and you can listen to previous episodes on various issues that has to do with the health of our children. And if you have any questions following the video, you can always ask your questions on our Facebook group, Ask the Pediatricians Facebook group. We are there Mondays to Saturday, and our goal is to make sure that we answer questions that you may have about the health of your children. And you know that you are going to be asking the pediatricians, so any answers you get, this is not just an opinion, this is a perspective from the pediatricians. So many people ask us questions, thousands of questions every week, and they are always happy. So we welcome you to ask your questions on our Facebook group, and we'll be very delighted to provide the answers. So thank you so much for joining me today. And like I said, today we're going to be talking about female genital mutilation, or sometimes we just call it in short FGM, because it's quite a long word. So let's just say FGM. And apart from, there are other terminologies. People call it female genital cutting, people call it female circumcision. So they are all the same thing. Well, for the purpose of today, I'll just use the word FGM, but just for you to know that we're still talking about the same thing, whether it's, we call it circumcision of the girls, or female circumcision, or female genital cutting, or female genital mutilation. We're still talking about the same thing. It's just basically a practice where parts or even all of the girls' female, the external genitalia is removed you know, for whatever reason. So, and this is something that should not be happening because it is really a practice that has absolutely no benefit, but has a lot of harm. And globally, we are all advocating for it to stop. And that is why, like I said, we have a day called the Day of Zero Tolerance to Female Genital Mutilation. And that was on the 6th of February every year. It's a day set apart by the international community to say we should not be doing female genital mutilation. And so it is important for all of us to know about this particular practice and for us to know what to do about it, and hopefully to also advocate for it to stop. Now, let's just talk about a little bit of background uh, to it in terms of how common it is. More than 200 million girls, 200 million girls and women alive today have undergone female genital mutilation in 30 countries. Is this a practice that is common, especially in places like Africa, the Middle East, as well as Asia? So it's a very common practice in this some of these countries uh, in this part of the world where we have mentioned, and a lot of this country are still doing it, and I think so in Nigeria as well. So it is 200 million women have gone through this practice, and again, a lot of girls are still at risk of this female genital mutilation. It is mostly obviously from the word female. It is usually carried out against uh, in young girls between when since birth or up to the age of 15. So it's quite common, and for a lot of places and cultures to do this so-called female genital mutilation. It's important for us to know that this is an unnecessary and a dangerous and a criminal practice because it is a violation of the human rights of the girls and women. It's a violation of the human rights of our girls and our women for them to be caught because even most of them do not consent to that procedure. And if you want to again define what is female genital mutilation, any procedure that involve partial or total removal of the female external genitalia or other injury to the female genital organs for non-medical reasons. Okay, so even medical reason, there must be something like is happening and you have to take it off. Otherwise, there's no reason to even be cutting or taking part of the female genital organs away. So any practice where no matter how small or big and a part of the female external genitalia is taken away, that is what is called female genital mutilation. This practice has no health benefits whatsoever for the girls and the women, and unfortunately it causes lots of complications, loads and loads of complications in women and in the girls as well. So it is something that we really need to stop. Before I go on, I just want to show you a little bit of the anatomy of the female genital so that we have an idea what we're talking about. For those of you who can see, let me just remove this banner. For those of you who can see, this is how the female external genitalia look. We usually call the whole thing the vulva. And so you have the mum pubis at the top here, and then you also have the big lips, what we call the labia majora, and inside it you have the smaller lips, the labia minora, and there's an open space inside those lips called the vestibule, and that is where the urethra and the vagina opens to. And on top of the meeting up of those big lips, the labia minora and labia majora, you have what we call the clitoris, which is at the top there. And then you also have the fascia, which is the ending part on the low on the posterior side of the vulva. So this is just how the female external genitalia look like. And I'm showing us this picture because when I'm talking about FGM, I'm going to be showing you which parts of this female external genitalia are removed in the process. And it is the removal of any or all of this. You'll be surprised that sometimes in some places they actually remove everything that we classify as female genital mutilation. A lot of people always call this external genitalia vagina. It's actually not the vagina. The external genitalia is actually the vulva, but the vagina opens into it. Your vagina is actually further down internally and you can't actually see it, but you can see the opening of it, which is what in the younger girls is covered by the hymen. So this the correct word for it is a vulva and not the vagina like some of us do uh call it. Okay, so that is just to show us the picture of the female external genitalia that we're talking about. So any procedure in which parts or some parts of this external genitalia of the girls is removed for non-medical reason, then that is FGM. And now this practice has no health benefits. There are absolutely no benefits to removing this the girl's vulva or part of the vulva, and there are complications ranging from bleeding to problem with the child passing urine, because you can see that the urethra opens into the festival, the space in between the labia, and then apart from that, it can lead to infection, other complications, especially when the girls are now grown up and they're ready to start having their own children. And so much complication, which I'm still going to go into details, because sometimes a lot of people, when we talk about these things, there are a lot of cultural and societal pressure, which I'm still going to talk about, that make many people to want to think, oh, that's how they've always done it in my place, and because of that, we should always do it. And you see, even educated women and even women living outside some of those African countries and Asian countries where they do these practices, taking their children from countries like Europe and America, where these things are of being outlawed and legally it's a criminal offense for them to do it, taking their children down to their other countries to just have that procedure done. And I think it's because most people don't even understand why this thing should not be done, because we don't realize how much harm we're doing to our girls by subjecting them to FGM. We don't, apart from the complications they're going to face now, or the complications they're also going to face in future. So we're going to talk about it, because this is something, like we said, zero tolerance. This is something that has got to stop. So I've shown you the female external genitalia and I've given you the definition of FGM. And now let's talk about the different types of FGM. So remember the picture I showed you about the female external genitalia, then you understand better now. There are different type of FGM. So there is a type 1, and in type 1, it's just the clitoris. There's either the partial or the total removal of the clitoris. Sometimes we call it clitoridectomy. So you don't forget the big word, just mean removal of the clitoris. So if they remove the clitoris is the most sensitive part of the female genitalia. That is where people tend to feel the pleasure during sexual intercourse. So removal of that clitoris is the type 1 of the FGM. I'll still show you the picture later, but there's also type 2 of the FGM. The type 1 is the most common practice. That's what most people tend to do in most places. But there's also type 2 where they don't just remove the clitoris, but they also remove the labia minora. Remember, the labia minora is the inner lip. So the female genitalia has the big fat lips on the outside. That is the labia majora. Then you have the smaller one on the inside. That's the labia minora. So when they remove the labia minora and the clitoris, and even sometimes with or without the labia majora, and that's the outer fold of the vulva, that is type 2 of FGM. And you also have type 3, which is even like they just we call it infibulation, where they actually not only remove all those things and they make the opening very small and even maybe cover it with something. So they form they cut and then they reposition the labia minora majora, and and they kind of leave just a little small hole. Sometimes they may leave, or they may even also remove the clitoris. This is, as you go higher, then the thing become worse. And then you have type 4. Any other type 4 is just any other kind of procedure that doesn't include the first three types I've mentioned to us. Any other thing people do to the vulva, either pricking it or piercing it or incising it or scraping it, or all sorts of things that people do, we put under type 4 of the FGM. So let me just show you a picture that show the different types. So in type 1, the blue part is the part that is removed. So the part that is highlighted in blue is a part that is removed in FGM. And this, if you see anything that look like a cross, that is a stitch, like they suture something. So in type 1, which is the most common, which is the least invasive or whatever, they just remove only the clitoris. That's type 1. In type 2, they remove the clitoris and the labia minora, and sometimes with or without the labia majora. And then in type 3, they not only remove, but they also stitch it up and leave just a little hole, maybe just for the urine or something to pass out. And then type 4 could be anything, any form of, either they are cutting it or burning it or piercing, or any of this thing putting on the external genitalia. That will be type 4 of the FGM. So you can see what happens when girls go through FGM. You can see that this is a very, very dangerous thing. So just to reiterate again, there is absolutely no health benefits. The reason why we need to emphasize is that nowadays people say, okay, but I don't have to, because when we talk about bleeding, when we talk about infection, they're like, okay, fine, I know how to overcome that by going to do it in a hygienic, aesthetic way, by actually going to a medical professional to do this so-called. And nowadays we're beginning to see some what we call medical FGM, where nurses and doctors who are from some of these areas are now even the one doing it, like they are going to do it in a sterile way. Of course, there'll be no bleeding, no infection, all that. But again, the question is, why are they cutting or removing this female external genitalia? There is absolutely no health benefits to this procedure. So whether it's done by the local women or the grandmothers, or is done by a doctor, a nurse in a hospital, it is still an harmful procedure, because there's absolutely no health benefit to FGM. And that is why we're saying zero tolerance to FGM. There's absolutely no health benefits. All that we get from FGM is okay, his harm. And I think it has, and unfortunately we find out that we women as well, we're actually the gatekeeper of some of these practices. This is not men forcing their girls to have FGM, it is women most of the time that are the one saying this practice must continue. And I think nowadays we our generation now, some of the old women are passing on, and I think it is important for those of us who are taking over to understand and to say, no, we should not continue with these practices. There are so many practices that people used to do before, culturally, and over time they realize that this thing doesn't cause any benefit. It's actually harmful, so we got to stop it. So there's nothing like, oh, that's how they've always been doing it. If something is not of good, it's not beneficial, then there's no reason why we should perpetuate it, because it has always been done. We just got to stop, and we got to say, from me, no, my daughters will not be having circumcision. Our own daughters will not have it, and that is how this practice will die out. So let's look at complications. What are the complications of FGM? The complications can be immediate, like right during the procedure, or it can be complication that will happen in the future. long-term complications. Of course, cutting somebody, and I think for most of you who have gone through those procedures, they don't put in anesthetics. I mean, so it's a very painful procedure for a little girl, a young teenage girl to go through. So it's a very severe pain because most of the time these things are done by local people who have the one saddle with the circumcision, and they just get the blade, most often unsterilized, and they use the same blade for all everybody and whatever. And that alone is a painful thing. These are immediate complication, the unnecessary pain that our girls have to go through for something that they don't need. Number two is the bleeding. We've seen people bleed to death from these procedures, and this is no exaggeration. So, because some people have some medical issues that if they are cut, and they can bleed much more, and they may not have ability to clot quickly. So, it's something that can lead to bleeding when somebody is having that kind of a procedure where you are cutting them up, and so the bleeding can be little, but it can also be excessive, and when from excessive bleeding, the person can go into shock, the person can die from it. So it's not only just the pain, there's also the bleeding, and also there's after such a procedure, there will be swelling, there will be inflammation around the area as well. So usually for the first few days, there will be a lot of swelling around there. And of course, infection is always a major issue. And when we talk about infection, we're talking about starting from things like bacterial infection, because these procedures are not even done in a sterile way. It's the same instrument that's not sterilized that is used for everybody. So there's infection, there's fever, and people can even die from that infection alone. Okay, and if so, sometimes children can get exposed to tetanus, and tetanus is a very terrible disease to have where they start having spasms, and some can die from that. So these are immediate complications, and of course, you can see that when I show you the picture of the external genitalia, the urethra where the urine comes from opens into that festival into in the vulva area. So if you just have that all these scars and all that, it's going to make it difficult for the person to also pass urine. And also there's a lot of wound from these scars, and from that wound it may be difficult for it to heal. So it may take days, and if it doesn't get infected, it may also take a long time before it heals. So also in the process of cutting the female external genitalia, they may also end up causing injuries to other structures, other tissues around the vulva itself. So these are all immediate complications, and these are serious issues. These are not just bleeding, infection like tetanus on their own can be fatal. So for something that a child does not need, why do we need to subject them to all these complications? So it is something that we should not be doing. So those are the immediate complications: the bleeding, the infection, the pain, the swelling, the injuries, even to other structures. Those are very serious uh, immediate complications of FGM. And that is why we as pediatricians, we as health professionals, the World Health Organizations, all of us are saying, as a global international community, let's say no to FGM. Let's stop it in these few places or countries in the world where it's still a norm for girls to be circumcised. We got to stop it. This is 2024. It's got to stop. All right. Now, those are not even those complications on their own are scary enough. But do you know that the complication do not end with the immediate, like during that procedure or a few days after the procedure? There are longer term complications, in these girls. So let's talk about them. Urinary problem, so that area. I've talked about urinary tract infection this year. For those of you who didn't listen to it, you may want to listen to it. But girls, because of the short urethra they have, that urethra opening into like the outside into externally, anything around that area, any infection introduced around that area during this manipulation, during this procedure, is going to introduce germs into the urethra, into the bladder, and that is urinary tract infection. And urinary tract infection, remember, it can even go up as high as the kidney, and that can also be very serious. So the girls will start having pain when they're passing urine and all that. And if we don't even manage that on time, that can also lead to them having worse infection involving other parts of the urinary tract, and then it can end up having kidney issues as well. So urinary tract infection is a long-term complications that can happen as a result of FGM. What other long-term complication? Even the vagina itself, because again, just like the urethra is opening into that area where there's all the cutting and everything going on, the same thing with the vagina is opening into the area as well. So germs can also go into the vagina area, causing what we call vaginitis or infection. And the child will start having vaginal discharge, they may start itching, they may start having pus coming out, or other infection, around which is actually the vagina now leads into the other, what we call the internal organs that are responsible for reproduction. And if you start having infection around those areas, then those ones are even more serious because of the implication on childbirth in the future. So these are problems, these are long-term complications of FGM, and this is why you don't want to subject your precious little girl to FGM. Another long-term complication is menses as well, because sometimes some of the procedures, really that type 3 or type where they actually remove almost everything and then still suture it up and leave only a small hole. When the girl is about to have a period, how is the period going to come out? So they will have pain when having the periods, and then they also have difficulty in passing out the menstrual blood. So again, this is a serious long-term complication. And of course, because it's a cut, there will be scars. When there's healing, excessive healing, you can have what we call the scar tissue, which can even become big, hypertrophic scars or keloids. So they now develop this, and Africans especially, we are prone to developing that excessive healing tissue or keloids. So, and that keloids can actually happen in the vulva area from FGM. So again, which can be quite difficult for the girls. Some of them are itchy, painful, and all that. The scarring around that area can be unsightly. So again, this is a long-term complication that you don't want our girls to have. Let's talk about sexual problems. Okay, because the clitoris, like I said, is one of the most sensitive area in the female external genitalia, and it is actually there purely for people to have that sexual pleasure and feeling. And in fact, most of the people that do female circumcision, this is one of the explanation, let me call it that way, the explanation they give is so that the girls will not have the urge to have sex. So when they remove the clitoris, the girl will not be promiscuous, but we all know that does not stop girls from being promiscuous. It doesn't. Those ones, even the more promiscuous they will be, whether you circumcise them, because over the years we've seen people who engage in all this sexual promiscuity. It happens among girls that are circumcised, just as it happens among girls that are not circumcised. So circumcision does not stop anything, and taking away the clitoris does not stop the girls from being promiscuous if they want to be. So that explanation is not a valid one. Okay, but for people when they not actually get married, then they have difficulty enjoying sex with their husband. They have difficulty enjoying because they have decreased satisfaction. Of course, there are still some other areas where they can get pleasure, but the clitoris is the most sensitive area for that. And so when it has been removed as a result of FGM, then those girls will have difficulty enjoying the sexual intercourse. And also some will even have pain because how the manipulation around that area, either because they narrow down the place again. So even it will cause pain for them as well. And that's why some the girls eventually become very frigid as adults because they can't enjoy it and they have pain, and so they don't even want to do anything with it. So these are complications that these girls will face. Unfortunately, a lot of people don't talk about these challenges. They just learn to bear it in silence, which will lead to another complication, the psychological complications, which we're still going to talk about. But these are issues, these are real life issues that FGM creates. Not only just the immediate complications of bleeding, infection, and all that, but these are long-term complications that these women have to deal with for most of their lives. Apart from the sexual issues, what about the complication of having children? Childbirth complications, again, these are even the major one. So difficult delivery is common in women who have been circumcised, okay, because the area is already narrowed down because of the cutting. There is some scarring already. So a baby coming out is not as flexible like a place that has not undergone any kind of cutting and all that. Then it can also bleed a lot. Okay, so eventually some of them end up having to need cesarean section to get out the baby because of that. um what has happened, the baby can't even come out naturally through vaginal birth, so they have to go through a cesarean section, and the babies themselves, because sometimes you're trying to see whether the baby will come out on their own, through the normal vaginal delivery, and the babies are stressed, okay, and eventually when we're like, oh, this mother has had a female circumcision, the baby is not easily going to come out, then we have to do CS and we have to resuscitate a baby that has been stress, and sometimes we can even lose the babies in that process. So, can you imagine this serious complications? So, who wants to put their daughter through all that, just to satisfy a societal norm or expectation and all that? We shouldn't. So, we need to start standing up as women, as girls, and say no to circumcision. And it takes, you just have to start with a particular generation and then we can put an end to it finally. So again, some women, because of the kind of procedure they have, they will need for them to have additional surgeries. So all those the cutting that they've had, it's caused a lot of problem. There's narrowing of the vaginal opening, especially for that type 2, which is the worst type. And so they need to have surgery to open up the vagina, maybe even for sex or for childbirth. And sometimes you have to do these procedures over and over again, So it's just so unnecessary, and it's just painful, it's stress for the women, and so it's just really unavoidable uh, pain. And sometimes, they when after they have a baby, you have to stitch it again, and they have to go through all these procedures, opening and closing, which now also creates another long-term complications, which we've talked about already, the immediate and the long-term complication of surgery. Surgery is always have its own complications. So if you have to do it over and over again for someone, then it increases the risks of all the other complications of surgery. So again, these are long-term complications of FGM. So I hope we are beginning to realize why FGM is really a violation of human rights. Nobody should be subjected to all these horrors for absolutely no reason, for something that has absolutely not a single benefit. And finally, just to end it at this point, because I guess we cannot exhaust everything, is the psychological problems these women face. And in my course of doing this work, I talk about FGM a lot every year. We talk about it, and I've seen women come into our comment section and talk about all these psychological issues they go through, how they are not enjoying their marriage, they cannot enjoy sex because they were circumcised as girls. Yes. And sometimes some women are depressed about it, some are anxious, some go through this post-traumatic stress disorder, they have low self-esteem. These are not, if I go back to our group, I can pull out these comments and show us. So there are psychological issues. These are grown women, and yet, because of what has been done to them when they were younger, they are still feeling the psychological effect of it, even as adults. So it is not all the psychological psychosomatic issues that people deal with that has to do with maybe just only mental health issues and all that we cannot explain. Sometimes some of them are rooted in this procedure that they've had when they didn't have the power to say yes or no to it. And we as parents, we as women, we owe it to our daughters coming after us to make sure they don't have to suffer all these issues because we just want to keep a particular culture that has no benefit of life. So I've been talking about FGM. For those of you who are just joining, we've defined FGM. We've talked about the any procedure that involves cutting or removing part of the female external genitalia, and I've shown you the female external genitalia, or what we call the vulva, and I've shown you the different types of FGM. The type 1, which is the clitoris removed; type 2, the clitoris and the labia minora, and sometimes labia majora; and type 3, where they actually remove almost everything and suture it and just leave a small hole. And then type 4, any other thing, the piercing, the burning, the cauterization, whatever other procedure that is done, non-medical procedure done on the vulva. We just put all of them on that type 4 because there are all sorts of things that people do. All these procedures are absolutely unnecessary. They are harmful. They have absolutely no single benefit, but rather they have loads of complications for the girls in the immediate, during, or shortly after the procedure, and in the long term complications of issues around child delivery, issues around sexual satisfaction, issues around repeated procedure, issues around having safe delivery and all that. These are things that are completely avoidable, that are completely unnecessary for our girls to go through. All we need to do is to say no to FGM, no to cutting your baby. And absolutely nobody has the right to insist that you must have your baby cut. And that is why it's so important to talk about it. And unfortunately, a lot of girls, a lot of women are still at risk. FGM is practiced in many countries, especially in Nigeria is Western Africa, Eastern and Northeastern regions of Africa continent. We need to wake up. We need to stop it. And it's also some countries in the Middle East and Asia. More than 200 million girls have been circumcised. 200 million. And more importantly, this is the ones I'm concerned about. More than 3 million girls annually are at risk of being circumcised. More than 3 million girls. It's a global issue. It's that's why we have a day on the 6th of February every year to remind ourselves that these 3 million children, it's got to stop. It's got to stop. And it stops with each of us making up our mind that I am not going to circumcise my girls. I'm going to tell my sister not to circumcise her girls. Or we are going to say we're not going to circumcise our girls in this family. And everybody just adopts that. And we have to stop. And I know that some of us in Nigeria say, okay, we don't want to do the cutting one. We want to press the minora, the majora, or we want to press with powder. You are doing type 4 FG, and that's what you're doing. Please stop. It is absolutely not necessary. Leave the girl's vulva alone. Honestly, just leave it alone. Wash it normally like you wash the rest of the body. Otherwise, you have no other business with the vulva of these girls. Just leave it. When it is time for them to use it, when they're mature puberty, they're ready to have they're married, and they're going to have the children, that is when they will use all those things. But before then, we have absolutely no business doing anything to the vulva, to the clitoris, to the labia minora, labia majora. We have absolutely no business with it. All right. And I'm really talking to us the women because interestingly, it is we women who perpetuate these things. It's not the men. We women are the one doing this, and we really need to stop and say our women should not be going through all this. Our daughters should not be going through this. Our girls should not be going through this. It is mothers that take their own daughters home or helping where to go and circumcise, even though they've gone to UK and all those places. And if you do that in the UK, it's a criminal offense. The police are going to arrest you. But of course, in Nigeria, I don't think we already have a uniform consensus about it yet. But this is from the point of let's educate ourselves and know why we should not do it. It is absolutely, I've shown you the pictures, I've shown you the complications, the immediate and the long-term complications. Why do we want to subject our daughters, our beloved daughters, to all these complications? So these 3 million girls that are at risk every year, we got to make it zero risk, zero tolerance, no FGM. Leave the girls' vulva alone. It is a global issue. We are really concerned. A lot of countries are making legislations against it and all that, but beyond just making laws and all that, it is about we understanding why we shouldn't do it to our girls. And I think that's what we've been talking about. I'm just going to end up on the issues around why you would think something this terrible, something this painful, something with all these major serious complications, you would think that nobody will want to do it again. But the reason why it is still an issue and why I'm still talking about it in 2024 is because there are a lot of cultural and social factors around performing FGM. People don't do it because it has any health benefits or because they don't know all the complications, but there are cultural and social reasons, and I'm just going to talk about it. It is more of a culture pressure, really. It's just like your peer pressure. This is a cultural pressure. It's a social pressure. Like everybody is doing it. In fact, some people they believe that if you don't do it, you are not yet a woman. You have not gotten. You have not. It's like a rite of passage, and that is what makes you a real woman. It is absolutely not true. Okay, and you don't have to be subject to all this kind of pressure. And you can decide that as for me and my family, we're not going to do it. So because other people are doing it, does not mean you have to do it. And it does not mean you are outcast or you are different or you're not a mature woman or you're not a real woman. All those things are absolute nonsense, okay? It is not the cutting of your female genitalia that makes anybody a real woman. In fact, you are actually going to have more difficulty becoming a real woman because you're going to have difficulty having sex, you're going to have difficulty having your babies when you do FGM. So it is women that are not circumcised that are actually going to find it easier to be real women. So let's not um subject ourselves to these pressures. And every day we see all these cultures. Culture is just basically what people have done over time, and they're just getting used to it. But we have to start now that we know better. Now that we know this things, maybe this is the reason why most of our children were dying. This is the reason why most women are having difficulty having babies and dying during childbirth, and we're never sure whether they're going to make it or not. Now that we have all this knowledge, this is 21st century. We have internet. We can do research. Why should we keep doing things that have absolutely no benefit, but all these horrible complications? Why should I be under that pressure just because that is what everybody in my village is doing? That is what everybody in this city is doing? No, you can decide that change starts with me. Okay, the change can start with you. And I think, especially for my generation, most of us are educated now. Most girls are getting educated. We thank God for that. I think we educated women now we should be standing up and saying no and not letting those our elderly women who don't know better, because that is what they've been taught, that's what they were passed on to them, and they just keep doing it. And now we know better, we should tell them no. There are good things in our culture, we should maintain that. Our culture encourages breastfeeding and know that we should maintain that. But if there are things in our culture that are not good, when we should stand up and say no, and we should not be under pressure to continue this practice that is very dangerous and harmful to our girls. Like I said, some people just it's part of being a girl. It is about raising a girl. It's about preparing her for adults. It's about preparing for marriage. I think you can see all the complications I listed. There is absolutely nothing in that procedure that prepares any girl for adulthood or marriage. If at all, this procedure is guaranteed to make adulthood, marriage, childbirth a, a difficult one for the girls. Yes, that's what it's going to do. It is guaranteed to make it difficult, painful, um, whatever, so absolutely nothing, please, absolutely no benefit at all. So we need to stop. And if you're a medical professional, please don't do FGM. Don't say, okay, I will do it for you on that steroid procedure. It is still wrong, even though of course your own way of doing it may make it maybe because you are going to put anesthetics less painful, and there may be less bleeding because you know how to stop bleeding. There may be less infection because you're doing under steroid procedure. But what about all the other issues? What about all the issues of uh, menstrual period irregularities, sexual dissatisfaction, difficult delivery, and all that, the scars, and all that, the keloids, all those complications that will happen as well, even if you've done it under a medical so-called steroid procedure method. Yes, there are still complications that will not go away. And for what reason? For what reason whatsoever? For absolutely no reason. For absolutely no benefit. We really need to stop. We need to stop. And some people also tell us that maybe there's some religious support. Actually, we've checked. There's absolutely no religion that supports female circumcision. Absolutely none. Absolutely none. So if you have any evidence, let us know. But we've checked, there is no. So we've checked the Bible, check Quran, check all the religious scripts. There's actually no one that supports that girls should be circumcised. Okay, and even the our traditional religion, I'm not sure that we don't have books and all that, but there is. So even most of the religious leaders these days are actually joining us to advocate against FGM. So it is not a religious thing, unlike circumcision, for example, for the boys, which the Jewish religion, even I think some other religions, that is cultural for them, and that has benefits. We talk about male circumcision, but girl circumcision, no, not at all. No, absolutely no benefit. Absolutely no religious backing. So it is just a practice that people have done over the years, and they kind of just get stuck on it, and nobody's thinking, is it helping us or is it not helping us? And people just keep doing it. And now that we know that this is actually not just a practice that is not just like, okay, it doesn't cause any harm, but this is a harmful practice, this is a violation of human right, then we need to stop it. We need to stop it. So today I've come here to do two things. One, to educate us on what FGM is. And I think I've done that. We've talked about FGM, we've talked about the types, we've talked about the complications, both immediate and long term. We've talked about why people still do it, the social pressure. And I'm really worried about those 3 million girls every year that are at risk of being subjected to FGM. And so the second reason why I've come today is to make a passionate appeal to my female friends, colleagues, to the mothers, to the grandmothers, to the great grandmothers, to my sisters. It's got to stop. It's got to stop with you. And can you imagine if all of us that you're listening to me now and you decide to say, I'll go represent my village, my local government. We have 777 local governments in Nigeria. And for those of you in your countries as well, you stand up for your local government and say, in this area, we're going to say no to FGM. And all of us agree, just to say no grief for anybody. This year, we have to say no grief for FGM. If all of us agree not to allow FGM to continue, it will stop. It will die because the people that are perpetrating it, they are dying already. They are going. So if we don't continue it, if I don't continue it, if you do not continue it, if our generation do not continue it, very soon our daughters will not even know there's anything called FGM. Some of our daughters these days, they don't even know things like the cassette. You remember those cassettes that we used to play music those days? Most of them don't even know what is called floppy disk anymore. They don't know what is called cassette because everybody is using CD, they're streaming and all that. Exactly, because their generation they can't relate to that. They don't understand what it means. That's exactly what we need to do to FGM. We need to make FGM something that our girls will never be able to relate to. Remember those days when people used to think having twins is they are demonic, you need to kill them. But these days, nobody even relates to that. Now everybody is happy to have twins. Everybody is excited. People even want to have twins. That is what we need to do with FGM. It's a practice that has absolutely no benefit, and we need to make it to stop. We need to make it to stop. So educating, but I'm pleading and begging you. If you're still one of the girls or one of the ladies, and I think there's absolutely nothing wrong, I see a lot of people. When I used to talk about FGM, people come and argue with me, and that it's always very hot. But I hope, for those of you are in that position, I hope I've been able to convince you and show you why you need to make it stop from you. It's got to stop, and nobody can force you to circumcise your girls. And it does not take anything from your status. If at all, it helps you to become a better woman who is protecting the girls from harm. We got to protect our daughters from all these complications that FGM will cause to them. So please spread the message. It is zero tolerance, zero tolerance to female genital mutilation. We need to hear the voice of our girls, and we need to make our voice known. We need to say it loud. We need to tell it everywhere and say zero tolerance. No FGM. It's got to stop. So thank you so much for listening to me today. If you have any questions about this topic of FGM, I would love to listen from you. Let me know in the comment section. Come to our ATP Facebook group. Come ask your questions there, and let's talk about how together we can put an end to FGM in Nigeria, in Africa, in Asia, in all those 30 countries of the world where this practice is still rife, how we can put an end to it. And I'll be very happy to hear from you. And of course, if you have any other questions about your children's health issues, feel free to post it on our Facebook group from Monday to Saturday. I look forward to coming away again next week, where we'll be talking about another important topic that has to do with the health of our children. Till then, say no to FGM. Bye.
Are you a mother, father, or you are involved in caring for children? If yes, then listen to Ask the Pediatricians every Thursday by 10 a.m. for insightful discussion on popular child health topics such as dangerous child health practices, immunization, infant feeding, developmental milestones, and so much more. You also get to ask questions on these topics and listen to answers to real-life child health issues by a pediatrician. Ask the Pediatricians Foundation is devoted to health education and information of parents and caregivers of children in the community to support you in raising healthy children. Don't miss Ask the Pediatricians with Dr. Gbemi, because it's informative, educative, and interactive. Ask the Pediatricians Hour, the program for caring parents.